Well, I think we'll get started here, folks. So welcome to the inaugural meeting of the Unified Task Force of Talent and Education, Economic Development, and Healthcare. My name is Bob Linscheid, and I have the pleasure of serving on the Executive Committee of the East Bay Leadership Council and also involved with the Talent and Education Task Force, serve on the Executive Committee. Today we've assembled an agenda. This will be a first, so bear with us a little bit if we have a transition difficulty between topics, but it was a decision of the board to, for lack of a better term, merge the interest of 3 task forces into an opportunity task force. The Talent and Education Task Force is led by Jake Bremner and Brian Dean. The Economic Development Task Force is Malia Cunningham and Elaine Schroth, and then the Healthcare Task Force, Cindy Hatton leads us. And so that's the way we'll approach the agenda today, is some reports. If we have a few extra minutes, those of you, for example, Satinder, if you have anything to add from Cal State East Bay, we'll give you an opportunity to do that. Ken, if you want to talk about the school district, we'll give you an opportunity to announce anything that you may have coming up under that agenda item. So welcome. We do have 26 participants today. I don't know, should we, Lindy, give an opportunity for people to introduce themselves, or that's a little unruly, isn't it?
Yeah, we've found that for the most part. Hi, everyone. I'm Lindsay Lavender. I'm the policy director here at the East Bay Leadership Council. Thankfully, I know most of your friendly faces. We have found that introductions are a bit difficult over Zoom with this many people. So my suggestion is that thank you for introducing all of our co-chairs, which is the planning team for this opportunity task force. My suggestion is, if you are comfortable, please go ahead and put your name and affiliation in the chat box. That way we have a record of who was here, and it's a way for others to have a sense of who's in the room and what organization you might be affiliated with or work for. And that way we don't have to go through each box or for Bob to try to keep track of the Brady Bunch here. Really quickly, I'd also ask if you can please mute yourself. It just helps with background noise and makes it easier for us to hear those that are talking. With that, Bob, though, I'll sign it back over to you, and I'll be sure to introduce myself in the chat too.
Great. So Brian Dean, would you lead us with an introduction of our first guest today, please?
Yeah, my pleasure. Thank you, Bob. Thank you. And I'm really pleased to have my colleague and my partner, Amy Wallace, join us today. Amy is, you know, for JP Morgan Chase, and I can say this without any hesitation, we long ago embraced the idea that supporting our local communities is not only good for humanity, but it's just good business. So we have a long tradition of being very actively engaged in the local communities, working to support those in need, whether they be individuals, whether they be various institutions, private and or public, but making sure that we are intimately involved. And it's folks like Amy who really do the spearheading of all of those sorts of initiatives. So give a little bit of what Amy does for us, and she does so much I got to read, so bear with me as I look away from the screen. So Amy oversees Northern California's grant making in the areas of workforce development, small business assistance, financial health, and neighborhood revitalization. And she also leads our firm's $75 million Bay Area Cities Initiative. So in that respect, she's very actively engaged with various organizations. And I'm certainly glad to have her here with us today. And Amy, I'll turn it over to you. I know I only mentioned a small bit of what you do, but there's a whole host of things you do, and you do such a great job of representing us. I'll let you take it from here.
Thank you so much, Brian. And thank you everyone for having me. And hello, Bob Redlow, good friend and colleague. I feel like now Bob's a ringer, so he can be equally as well-versed on some of the things that I'm going to talk about as I am. So I know you guys are obviously a super strong team, and excited to hear more about what you guys are doing. So as Brian mentioned, I'm part of our corporate at JP Morgan Chase. And I do grant making across all of our pillar areas here in Northern California. And for us, that really is focused on kind of primarily the Bay Area. We do work in Sacramento and Stockton, but really think about kind of the sort of 9-county Bay Area as kind of central to our impact area for that philanthropy. So Brian asked me to just talk a little bit about some of the things that we're doing here locally that I think we thought could be of interest to this group, and then something actually that we are spearheading in New York, which I think has potential for overlap or lessons or as a framework around what you guys are doing in the East Bay potentially. And I will try to be brief. My background is actually almost entirely in the workforce development field, so I could talk about this, as Bob knows very well, for days at a time. So feel free to cut me off or insert any questions as I'm going along. But for our work around workforce development or jobs and skills for JP Morgan Chase, we're really focused on kind of 3 key areas at the moment. The first is skilling up new workers, but also in this environment, reskilling incumbent or existing workers to meet changing and evolving conditions within businesses and with employers. I would say that's kind of the central piece of the work that we do in terms of our grant making. And we do that by partnering with community colleges, nonprofit organizations, some K12 work, although less of that in California, candidly, than we do in other parts of the country, but really look to create partnerships with training providers in order to support their ability to evolve curriculum aligned with employer needs. The other piece of that is really around leadership development and specifically for community college leaders. We've done a number of investments nationally and locally in the community college systems and in individual community colleges, and are now trying to take a more proactive approach to organizing that work around really building up kind of a next generation of leadership within the community college systems. And then finally, and I'm sure all of you are working on this as well, is really taking an equity focus to this work. So really looking at who has been left behind in the labor market, what that looks like locally, and how we can be helping to build systems and structures to both break down those barriers, but also to make those pathways easier to access for folks who may have some more challenges or barriers to employment than others. So locally, I've been with JP Morgan Chase for 3 years now. And in that time, we've funded a number of things that I think kind of speak to this, just to give you an example. So we've actually done quite a bit of work with local business or employer associations. So with the Bay Area Council, Silicon Valley Leadership Group, and others around the state of California, really to provide them with some resources and a framework for organizing their own conversations about what their business needs are and how to translate those effectively into whether it's the K12 system, the community college system, or four-year institutions. So that's a pretty important piece of the work that we've done to kind of lay our groundwork for our systems work in California and the Bay Area specifically. The other thing that we're doing that's actually specific to the East Bay is we're just beginning to do some work around data analysis and moving into next year validation with key employers and businesses around kind of what is the new landscape of technology skills and making sure that we're not just looking at technology jobs. So really thinking about the breadth of skills that someone coming into the labor market or needing to advance their skills who's already in a job, what are the things that really are important and incumbent that they'll need to be able to to learn and to do in order to advance from a technology standpoint, and thinking about that as kind of a new framework for how we do our work that's not necessarily specific to a particular industry sector like technology. And then, of course, some of the other things that we do are, we of course fund nonprofit organizations to actually do a skills training, whether that's in partnership with a higher education institution or as a standalone. So recently we've started working with SF Made, which is a group that organizes local small manufacturers starting in San Francisco, but we're actually working with them to expand their work over into the East Bay so that they can provide some training and resources for employers, manufacturing employers that are in their area. So the final thing I just wanted to touch on, and then I'll stop, and any questions or thoughts or feedback, much appreciated, is we recently announced our participation in the New York Jobs Council, which is a really senior level advisory and organizing board co-chaired by our CEO, Jamie Dimond, and includes some of the largest employers in the country, really, Amazon, Accenture, IBM, McKinsey and Company, and others, really focused on meeting the goal of employing 100,000 New Yorkers in local jobs by 2030. And this platform, I think, is something that's really, it's obviously so important to have employer voice in a jobs system, as you all know, I'm sure very well. But this is really trying to put some backbone and structure behind that effort, and it includes the city, the community college system, and the K12 system, as well as a number of apprenticeship organizations to really make sure that the curriculum that is developed is on point and tracks with jobs that are currently and going to be available, really brings in aspects of the hiring process into the conversation around how those jobs will be filled, and also has a very specific emphasis on early career New Yorkers and those who are from disadvantaged background, primarily Black, Latinx, and low-income New York City residents. So this, we absolutely think is a model that we'll be wanting to explore in other parts of the country. Obviously, New York is, it's a large city, but it is one city. And so I think it's very interesting to think about this from an East Bay perspective, where you have a variety of obviously governments, institutions, employers working on a more regional basis, but definitely see this as a potential model and framework for how we're also organizing our work moving forward in this area. So I'll stop there for any questions or feedback or anything, Brian, that you think would be helpful for this group.
Okay, great. Debbie Toth, you have the first question. Before you unmute yourself and ask it, please, if you have a question, merely type the word question in the chat area and we'll call on you in the order received. So Debbie, please.
Operators are standing by. I'm sorry.
I love that. That's so official.
That's just what it sounded like. It's only because I didn't follow the instructions that everybody had to get the instructions. You're welcome. So I'm Debbie Toth. I'm with Choice in Aging. We're a nonprofit organization that provides support services in the community to frail elders and people with disabilities to assist them in continuing to live in the community instead of skilled nursing facilities where they're dying in droves right now. And my question about workforce development and funding of nonprofits is, how does the healthcare field of employment fit into your priorities, if at all? I want to just describe a brief problem that we have that we solve for. So we have a radical underdiagnosing of Alzheimer's disease, 42% or so, if you look at the statistics on the Alzheimer's Association. And part of that is curriculum. So these physicians aren't trained to test for that. And actually testing is quite a process, but they are not willing to give a diagnosis where they think that there is a diagnosis because they don't have that area of expertise. The workforce is not developed around that. We're a very ageist society. So in addition to the fact that we marginalize people based on the color of their skin, we also do it based on the number of wrinkles and gray hairs. Hello. So we have this institutionalized deficit of expertise in the healthcare workforce because of all of these reasons. And so we at Choice and Aging bring in licensed vocational nurses, certified nursing assistants. I do doctor physician when they're going through their rotations and their residency, like everything we possibly absolutely can, but there's no funding to keep that going. So everybody gets added work on top of them to try and help train the workforce that's going to go out and make big money at John Muir or Kaiser or wherever, not continue working at a nonprofit community-based organization. And I am totally coolio in the gang with that, as long as we're able to support it. So I'm just wondering if you look at those kinds of things as well, or is it just more like, how do we get community college people into, up in, or, you know, can you address that?
Yeah, I would say that's a great question. And I think definitely it's kind of a geography or market by market situation. So for us, we've done a lot of funding in healthcare training, really for some of those more what we consider kind of entry level or career path, early in the career pathway positions. We don't do RN or physician training at all with our philanthropic dollars. But absolutely, I think particularly as we think about community clinics and the like as on-ramps to longer term opportunities for folks, I think that is of interest to us. I also think the other thing that's really critical, I think, in this period, as we kind of think with our equity and kind of a healthy community perspective, is, you know, we want the healthcare that folks are receiving in the communities that are, for example, most impacted by COVID, to be culturally competent, to be, you know, living and working in the communities that they serve. And so that is absolutely something that we, you know, that we look at as we think about our grant making and kind of what that looks like in a particular market. This, of course, is coming up a lot around the issue of contact tracing, you know, a sort of healthcare adjacent, I guess you would consider it, position, but clearly a huge need, but also a real need for that to be very community connected and community driven, given who has been impacted by that crisis.
Thank you.
So Lindy, you're next. Would you ask your question? Go ahead and unmute yourself.
Absolutely. Hi, Amy. Thank you for being here. I really am interested to see this data that you guys are collecting on skills, and I hope that you'll share that broadly, because I would definitely love to see that. But kind of in that vein, I'm curious, does JP Morgan Chase themselves offer on-the-job training or apprenticeship programs? And if so, kind of how do you play a role in developing that?
Yeah. So great question. So at the moment, you know, because we are part of the corporate responsibility arm, there's actually a pretty significant firewall between what we do from a grant making perspective and the business side. So locally, we do not overlap very much in terms of thinking about the kinds of trainings that we can support and the like. Nationally, though, we are looking at a few pilots in New York City and Chicago, both around technology positions and partnering around technology apprenticeship, and looking to bring folks who we have supported through some of those kinds of trainings into the actual business to be apprentices and you know, kind of embedded there. And then in Chicago, we have a pilot actually around second chance initiative or returning citizens. So really looking at those who have been involved in the criminal justice system, and how can we be working to bring those folks into our employee ranks. And that includes actually a pretty extensive policy piece that we're doing, because we are a financial institution. Many regulations around who can be employed and get various certificates and licensures, as you can imagine. So really trying to break down some of those policy barriers where it makes makes sense, and where the, the risk is not, outweighed by the benefit of bringing some new folks in. So the idea is that once we've done these pilots in some of our larger market areas, we would be able to bring those into places like the Bay Area, which is kind of an emerging market for us. And absolutely, I'm happy to share that data and may even ask some of you your thoughts and feedback on, does it ring true given what you see within your own businesses or classes.
Great, Amy, thanks. Julia Dozier, would you like to ask a question, please? This will be our last one for this section.
Thank you, Bob, and thank you, Amy, for being here. My name is Julia Dozier. I'm with the Chabot Las Positas Community College District, so my ears perked up when you mentioned this. One thing that you mentioned in passing with New York is including apprenticeship programs with the other things you're doing. Yep. And I think that a lot of people in businesses that are not in the trades are not aware of the fact that apprenticeship programs are now in many, many different industries. And in California, we've got something like 91,000 apprentices. And the largest group of them are actually with computer security. So one of the things that I'm interested in is getting the word out there and exploring new areas. We're working with 3 different organizations that are doing, looking at things in healthcare, for instance, to mention. And I'm wondering if there's how you get the word out, and if there's a means through your program or whatever that we can let people know that this is, whether they're with us or with another community college or whatever, that the apprenticeship model of learning in classroom and doing on the job is so effective that I'd really like to get the word out about it.
Absolutely, absolutely. So your comments totally resonate with me. And in my previous life, I actually staffed the California Workforce Development Board. That's how I know Bob through his service there. And a big part of the work that we did was actually in trying to bring on board non-traditional, right, non-construction apprenticeship programs. So in healthcare and IT and a whole variety of other industries or occupational areas. So, the value of being able to learn while you're earning cannot be underestimated. I think both for employees and learners, but also for employers, right? Because it's obviously a great and very secure way to make sure that folks are skilled up in the way that you need as a business. We don't do a lot of, at JP Morgan Chase, we don't do a lot of work around sort of marketing of particular programs or things like that. We have had a long-standing partnership with the Foundation for California Community Colleges. I'm sure you know those folks well. And actually a lot of the work that we've done is to support them around kind of getting the word out and helping to spread knowledge around how to both, create a new apprenticeship program or other kinds of earn and learn opportunities. I think that's also really important because a lot of folks, again, there's kind of a very narrow definition of apprenticeship, obviously. So we don't do that really directly, but I'm always happy to, sort of individually share, and I know your institution very well. Would love to be able to share anything that we can sort of on a case-by-case basis or in just some of the sort of presentations or conferences or things like that. So I can forward my contact information, and you should feel free to get in touch with me directly.
I sure will. Thank you very much.
Great. Amy, thank you so much for your portion of the agenda today. We really appreciate it. And if any of you have any additional questions, we can filter them through Lindy or myself onto Amy or Brian. Brian, thank you for this portion of the agenda. Just want to make one quick announcement before we go to economic development in Elaine, and that is the East Bay Leadership Council Board of Directors supported Proposition 16, which you'll hear more about on the ballot. We may try to do an individual separate meeting on this topic, just so you all can be aware of the importance of that issue in the minds of East Bay Leadership Council. But wanted to let you all know about that portion. So Elaine Schroth, would you please convene the economic development portion of this meeting, please?
Hi, and good afternoon. So I'm Elaine Schroth. I'm the CEO for Visit Concord, and our job that we are tasked with is to create awareness of Concord and the Mount Diablo region, the East Bay. We are funded through the hotel tax, so obviously this is a little bit of a trying times during budgets. And so right now we're really working strongly with the community, recovery focused, what the future holds, retraining holds, and future marketing for our area. So with that, Amalia, who's the Economic Development Director for Contra Costa County, and I just kind of created more of like a wish list of topics that we had in mind for the Economic Development Task Force, and ideas that are really top of mind for us. And for, from the county's perspective, the first one is how to replace sales tax revenue without impacting the business operations too much. You know, are we increasing business license increases, you know, that sort of thing, TOT. I heard a lot of discussion yesterday at the candidate forum for Walnut Creek regarding that. How to help retail and hospitality workforce retrain or find new placements. And again, that's something on the top of all our minds. And that was just touched on by Amy quite a bit last time. So that was really great information. And so really kind of keeping that top of mind. And then should we, as a society, should we be encouraging more building of residential on commercial and religious sites? The county, this is something important to the county, as the state of California is definitely encouraging that with some legislative changes. What's happening? The question is, again, back to the sales tax, and are we ever going to get back to previous brick and mortar levels? So these are our kind of top upper level topics that we have with the Economic Development Task Force. And so I don't know if there's
any
questions.
thoughts from anybody? Anybody have any perspectives they'd like to offer regarding those three? To remind you, her first item was how to replace sales tax revenue without impacting business operations too much. Second was how to help retail and hospitality workforce retrain or find new placements. And the third, should we as a society encourage more building of residential and commercial religious sites? The state of California is definitely encouraging that with some of the legislative changes. Any thoughts anybody have?
So I think we would like to then like kind of flush that out. And we can certainly do that for the next task force meeting.
Great, super. Well, I know that you
That's a lot to think about.
Pardon me?
Sorry, I just said thanks, Elaine. That's a lot for us to think about.
Exactly.
Well, what I appreciate here on the perspective is that we have quite a region represented here, from, you know, Pleasanton, Oakland, all the way up to Concord in that region. So those thoughts are going to be important not only in Contra Costa, but also Alameda County that's represented here as well. So, okay, well, it looks like we've got our charge for the next meeting, which is October 21st, Elaine. So hopefully we've got some initiatives we can chew on before the November election.
Okay, that sounds great. And I also see Sophia related to lack of housing building on commercial and religious sites seems a worthy discussion. So I like that input. Thank you. So
Great.
We'll go that way as well.
Super.
Can I just make a quick note on that, Bob, really quick?
Sure.
I just wanted to chime in and say that I agree. I think it's certainly a worthwhile thing for us to continue to talk about. And I'd really like to hear some of our local jurisdictions' feelings and thoughts on that. Because I know sometimes when we talk about development, there's an interest in commercial development, if there's going to be development. But this is really concentrating instead on housing. And so understanding that like that religious site may have stayed a religious site permanently, and then there wouldn't have been housing or commercial built there. But I just wanted to chime in and say I definitely hope that we can also maybe cue in some of our local cities and perhaps even the county to get their perspective on that as well.
Great. Okay. Cindy Hatton, would you convene the healthcare task force, please?
Hi, I'm going to turn it over to Lindy because she's going to go over some legislation, 3 legislation bills that have passed.
Great.
I am. Thank you, Cindy. Yeah, so Cindy and I talked briefly about these bills and thought they would be ones worth highlighting to the group, especially it's an advocacy organization and the healthcare task force specifically always being very invested in the advocacy side of our work. These are bills that we had talked about in the healthcare task force this year. The first I want to highlight is SB 803. And before I really get into any of this, if anyone has questions or wants to talk about these in depthly, I'm always available to do so. I won't be able to get into the nooks and crannies of all of these bills today, but hopefully I'll give you a bit of an overview and we can reflect on anything that we might want to talk about as a group, hopefully with a little bit of time left over. So SB 803 is a bill that we had supported as a task force actually 2 years ago, but was unsuccessful and then was reintroduced this year with some small changes and was successful, at least in getting through the legislature. It has been enrolled and is on the governor's desk. So SB 803 relates to peer support specialists. We tend to see peer support specialists in a lot of nonprofits that deal with consumer-to-consumer mental health support or substance abuse treatment support. But it's certainly not the only location. For example, I've heard of organizations having interest in peer support specialists that are dealing with like new mothers and supporting, new mothers. So it's a field in which there's a lot of interest and certainly a field in which there's hope that people could move into positions without necessarily having to have the high level of academic background that is often required to provide kind of mental health support. So this kind of gives an entry point for often those who have been consumers who now want to help their fellow people experiencing similar things that they have. Again, this is really prevalent in like substance abuse treatment or in mental health support field. So SB 803 will allow a certification process to be looked at with the hope that eventually those positions will be able to be Medi-Cal funded. So again, if you have any questions about that, happy to talk more in depth of it. And there actually are likely some on the call that have been a little bit more versed in the background of this than I have. So if anyone wants to chime in, more than happy to hear your thoughts. The other bill I wanted to highlight is AB 809, which was the bill that related to nurse practitioners. Sorry, I said 809, I meant 890. This bill related to nurse practitioners. Again, this is a bill that we've seen come through many times, and weren't so sure how it would progress this year. It's been interesting to watch how COVID has impacted what moves forward and what doesn't. This bill did move forward. It's been enrolled, and again, is awaiting the governor's signature, at least was as of yesterday when I checked in on it. This would allow nurse practitioners to practice without a supervising physician. There's about 20 to 21 states in the United States where that is the case, and this would make California one of those. As you can imagine, this has been a heavy conversation amongst doctors and nurses, and there's been somewhat competing interest and thoughts and opinions on this. If anyone wants any of that background, happy to provide it, but for now I'll just leave it to say it did make it through the legislature this year and very likely will be signed by the governor, though we don't know for sure. The last bill that I wanted to mention was a Steve Glazier bill, and I left it towards the end because I think it might prompt the most conversation. It essentially made it possible for us to have a Contra Costa County sales tax on the ballot this year. So I won't get into too many of the details of the bill because they're not as relevant. What is relevant is that Measure X will be on the ballot. This is a sales tax, a half-cent sales tax measure here in Contra Costa County. And I'm going to note really quick, there's also a half-cent sales tax measure in Alameda County. That is Measure W. We'll be talking about both of these at the board meeting, the East Bay Leadership Council board meeting on Friday. But if anyone has any questions, again, happy to answer them. Essentially, this will raise about $81 million for the county should it pass, and it's a general sales tax, so the county cannot say exactly what those funds will go to, But what they can do is give you some sense of what their priorities are as a board of supervisors. And what we've heard from them is that there's an interest in investing in the county hospital. There's an interest in trying to support emergency services and fire. And then there's a handful of other things they'd like to support, including early childhood education, trying to reduce abuse in our county in many different forms and ways, and also possibly an investment in what we would call like general services. Behind the scenes, a lot of the time, I think that's often thought about is trying to make sure there's a workforce that can help to allow people to get the benefits that they're needing. So that was a lot. I talked about a mile a minute. But if anyone has any questions or wanted to bring up other bills that they had been following or were interested in, those were the ones I wanted to highlight. Thanks, Cindy.
So Lindy, could you remind everybody the other task forces? Because economic development, obviously creation, retention of jobs, that is real important to this task force, but there's also a housing task force that relates to some of the issues related here. So could you remind everybody the other task forces too?
Yes, absolutely. Happy to do so. And I will say, in taking on this pilot in which we took the 7 task forces and really kind of put them into 3 task forces, that was somewhat difficult in its own right, because what we found was really, I mean, a lot of the times we could have one task force because so many of the issues that we talk about and think about really do interplay and work within each other. So the 3 task forces that are part of the pilot that we're doing right now at the East Bay Leadership Council are the Infrastructure Task Force, which is primarily transportation and housing related issues, the Opportunity Task Force, which you're all a part of right now, and the Water and Environment Task Force, which we playfully refer to as the WE Task Force, which is made up of what was the Water and the Environment and Manufacturing Task Forces.
Great, super, thanks for doing that. So any comments or questions at this point before we go next to the Equitable Economic Recovery Task Force report?
And I just want to say that, you know, for the people who've been on the healthcare task force, if there's topics or things that you want to bring up for our next meeting in October, please send them to Lindy and I, and we'll get through them so that we'll make sure that we cover those in our presentation. We talked about COVID, and I think for the healthcare people, we're COVID all the time. And so I don't know, you know, we have our new tiering system. Contra Costa County, Alameda County, Solano are still in the highest category, which is widespread. So we have a little ways to go to get there. I think we continue to have, at least from our experience, we continue to have slow turnaround on testing, which is also causing issues. And I don't know if anybody else has any other comments, but that was all we were going to report on.
So Debbie Toth, you're next, and then Rebecca Rosen.
Thank you. So thanks for the presentation there, Lindy. I do want to highlight that there's a lot of intent and work being done behind the local sales tax measure around where that funding goes and looking at, you know, historically marginalized communities. And I want to remind everybody that included in historically marginalized communities are elders and people with disabilities, because they get left out of the conversation. And what we're seeing with COVID, as Cindy said, COVID in the healthcare world is not anything new. It's like putting a magnifying glass over all the existing inequity and folks who are marginalized. And you see 3 times the death rates in the people of color, Black people, marginalized communities happening. And 79% of the deaths nationwide are people 65 and older. So I think those are important things to constantly keep your mind aware of. We are seeing what we're seeing because there's been a history of bad behavior in skilled nursing facilities, and the list goes on. So I want to say that there's an importance behind why we're looking at this sales tax measure and what we need to lift up in it. And I also just want to kindly remind everybody that people's lives are impacted who aren't dying in skilled nursing facilities because they can't have their visitors and their families come to see them that they love and rely on. And if you know somebody and you can call or you can get a tablet in for them to see you, if you have elders in your neighborhood, I just can't stress strongly enough that the current cure for this pandemic is isolation, which is the always killer for the aging population. So just keep that in mind. Thank you for letting me do my PSA.
No,
Before we
thank you,
turn it over-
Debbie. And I just wanted to also mention, since we're talking about the sales tax, that Mariana Moore is here with us, who worked tirelessly on this and is a great source of information. There is an effort to create an oversight body that would be involved in helping to look at how these funds are spent. But I just feel important to emphasize that it is a general sales tax, so we can't guarantee that right now as we talk about the measure itself.
Good. Okay, Rebecca, your comment.
Yeah, my comment actually wasn't about the sales tax or healthcare issues, so I could talk on end about COVID if you really wanted to. It really had more to do about the opportunity task force as a whole, since you were going through all the task forces and how the EBLC has reorganized. And I'm just wondering, are we as an opportunity task force going to take some time to think about some areas across our, we have 3 groups that came together, and are we going to look at cross-cutting issues and sort of focus on that, or is this just more of a forum for each individual task force to kind of take what they've been working on so far? I was just trying to, more of a understanding of how we want to proceed as a larger group.
Lindy, do you want to talk about that, or would you like me to? Go ahead.
Absolutely. I'll start, but then I'll kick it over to you, Bob, because you speak so eloquently. I just want to say that yes, that is absolutely the hope. And I think there is so much crossover amongst these groups as it is. And part of the intention is that these co-chairs will get together every quarter and think about what the next should look like, so that we are working together and working collaboratively and hopefully finding topics where there is a lot of crossover, so that when we do bring together a group like this with such amazing minds in the room, that we're able to really think about some actionable things or ways that EBLC might be able to be involved. So yes, that's certainly my hope, but I'll look to Bob because I know he can speak to this too.
Well, Rebecca, thank you for the question. We thought the best way to get started on this effort was to get started and unpack this thing as we go. And the ideas that you're mentioning are very relevant to how we want to approach the future. So if any of you have agenda items or discussion items, while we have a scheduled effort, that doesn't preclude us from meeting in side groups to talk about specific issues. So let's keep that in mind. If anybody wants to advance an idea, for example, we talked a lot today when Amy was mentioning the role that JP Morgan Chase was playing in upskilling the workforce in those arenas. Well, sometime soon, perhaps we would want to have Brian Cook from Cal State East Bay Extended Ed, or somebody from the community college system, talk about the role that they're playing in helping to upskill, particularly in the areas that Elaine mentioned. The retail and hospitality workforce needs to be retrained and upskilled for jobs that don't longer exist anymore. So those are the kinds of conversations that I think will happen as a result of us engaging on the topical issues at hand. So thank you for bringing up that comment. Okay. Yes, Debbie, flying a plane, building it while you're flying it. Yeah, that's right. Okay, Lindy, would you update us on the Equitable Economic Recovery Task Force that's been meeting over the last several months?
Lindy?
Absolutely, but Bob had a question really quick.
Right, thank you. Yeah, I just had a quick comment and sort of a question, I guess. And I think this is important to mention, and we probably mentioned it before, but I think it's a major issue. You know, we have a lot of, and this is under the healthcare task force, obviously, but you know, we have just a ton of healthcare training going on throughout the county with lots and lots of different groups. And, you know, we're all having the same issue of not being able to complete our clinicals for our training because of COVID and many other issues. And this is a major issue. And as this, you know, drags on longer and longer, and our programs, some of our training programs have been canceled and some obviously have been delayed. This is going to cause quite a shortage in critical jobs as we move forward, whether it's in specialty nursing or whether it's in imaging or other areas. And this is an issue that's going to come to, you know, and mental health issues. And this is an issue we're going to have to deal with in 2021 and 2022 because of what's going on in 2020. So I just wanted to put that up as a major issue, you know, maybe down the road to talk about, or things that we can work on to figure out alternatives to how we get those clinicals completed for all those health training programs.
Thanks, Bob. I'm sorry I didn't see your hand up. Okay,
That's okay.
thanks. All right, Lindy, go ahead with the Equitable Economic Recovery Task Force.
Absolutely. So you guys are hearing a lot of my voice today. I don't anticipate that that is how all of our Opportunity Task Force meetings will be, but I appreciate your patience with me, and I'll try to talk a little bit slower as we talk about this part of our agenda. So the Contra Costa Economic Partnership, which is a sister agency of the East Bay Leadership Council, has convened in partnership with Contra Costa County, primarily the Employment and Human Services and the Workforce Development Board, an Equitable Economic Recovery Task Force. So that was a lot of acronyms, but essentially we've convened a task force and we've asked about 40 community members, about half of which are coming from the public sector and about half of which are coming from the private sector, to meet with us to think of areas in which we might be able to make some recommendations about how here in Contra Costa County, we might be able to see some equity in how we look at economic recovery post-COVID, or even during COVID in some cases, because some of these conversations, for example, one in which Bob has been really helpful with, has been about broadband access, which is certainly something that we need to address now, not in a year. So this task force, again, has about 40 members, about 45 if you look at the whole roll, but obviously not everyone's able to join us every 2 weeks to a month. We recently went from bi-monthly meetings, so meeting every 2 weeks, to monthly meetings, in part because we hope that that'll give time for people to kind of gather in between meetings, but it also allows us as staff to do the same, to really come with some data. I'm realizing that I might be breaking out a little bit on you because I just got a notification that my internet is unstable. So I apologize if that's occurring. I might actually turn off my video really quick just so that everyone can hear me. So this task force, again, is really trying to think about what some of the main topics we should be considering are as an entity that is looking at economic recovery. So we have put together 5 primary groups, and those groups are going to be working on these 5 issues. I'm going to name them. So we're going to be talking about funding and funding needs here in Contra Costa County. That might look a little bit at the sales tax, but it's also just going to be talking about where funding becomes an issue. We're also talking about the healthcare workforce. We're talking about marketing industry. So recognizing that there's industry here that really has somewhat of a unique place within our state, and how to kind of market that and make more opportunities available for those that are interested in those industries. We're also talking about broadband access, as I mentioned, and then we're talking about on-the-job training and possibly wage subsidies. So those are I'm sorry, I said 5, but I meant 6 groups that we convened at our last Equitable Economic Recovery Task Force, and that we'll convene again at our next Equitable Economic Recovery Task Force. I don't suggest those are the only topics that this task force is going to be looking at, but those were some of the directions we felt driven towards as staff, and were supported by the county. And we're working on getting a lot of data for those groups and some other information for those groups so that they can hopefully look at what recommendations might be most beneficial to Contra Costa County, both to the actual government of Contra Costa County, but also to private partners as they think about what their contribution can be to an equitable economic recovery. It was broad, but I'm happy to take any questions, and I'll turn my video back on so that I can hopefully engage. Bob, as a member of this task force who've been really helpful from the beginning, please feel free to chime in and share your reflections.
I think that I offered my email address to folks. If you have any thoughts going forward, please feel free to reach out to me. Mike Moore just sent a note out that what about the impacts from the closure of the Marathon and repurposing of Phillips 66 refineries? That would be probably a good question for our economic development group, would it not? Mike will charge over to Elaine and Himalaya maybe to have I know that we've had direct discussions with those that are representative of those refineries. Lindy, could we get an update on what's happening with those and the ideas going forward?
I can share this. I know that here at the East Bay Leadership Council, there's an effort being made to possibly host a meeting actually with Phillips 66 so that we can really get and hear from them kind of what their thoughts are on the conversion they're looking to make and what that process will look like. It's possible that as an organization, we might look to be supportive of that. And to support, perhaps like their permitting process as they go to make some changes over there. I have not been privy to that as exact conversations, but I know it's something we're looking to bring to the East Bay Leadership Council and to have, perhaps a meeting or to bring it to the board to talk about what that conversion might look like and what its impact will be on jobs locally. So I look forward to sharing that information with all of you. I just haven't had the opportunity to do so yet.
Great, thanks. So in the time remaining, we have several people that are on here that represent organizations. Satinder Mali, I see you were able to join us today. Thank you for being here. Could you give us any information or update at Cal State East Bay?
Sure. Good afternoon, everyone. It's nice to see some familiar faces here. For those of you who have not had the opportunity to meet, my name is Satinder Mali. I serve as the Associate Director for Government Community Relations at Cal State East Bay. And as many of you may already know, we are operating in a near virtual environment at all of our 3 campuses, our home main campus in Hayward, including as well as the branch campus in Concord and our Oakland Center as well. So the CSU did recently announce that we will be continuing to operate in a virtual environment for the upcoming spring term as well. So that decision was not taken lightly, but our Chancellor, Timothy P. White, in consultation with presidents and health officials, thought that that was the most prudent course of action given the ongoing challenges presented by the pandemic. And then in terms of other announcements, you can expect an announcement regarding who the new chancellor of the CSU will be. I think that should be forthcoming in the not too distant future. And we are still conducting a search for a new president as well. So there'll probably be some information to share with all of you on that front, later this fall. So that's about it.
Thanks, Satinder.
You're welcome.
Ken Mintz, K12, any thoughts?
Sure, thanks a lot, Bob. Good afternoon, everyone. And I first want to thank you all for participating in this first of the opportunity task forces. It's interesting when I look at K12, and so my role, I'm the chair of the EBLC, but in my role on a Board of Education for San Ramon Valley Unified School District, I'm directly involved right now in what's going on with our school kids. And as the Satinder just talked about, being in remote learning at the college level, that's where we find ourselves at K12 as well. It's interesting how the opportunity areas all seem to converge on this particular issue between, the COVID being the issue and risk within our community and how we're trying to resolve that. You get into the education side, how it's affecting our students and our teachers and our learning opportunities, and then how that turns around and affects our economic development, particularly as it relates to people being able to get back to work, and even as they do, being concerned about childcare and those kind of factors. I can tell you from a board meeting that I had last night, a very extensive 7-hour board meeting, just looking at what it looks like right now and what does it look like next. As was mentioned earlier, here in Contra Costa and also Alameda counties, we're sitting at the purple level. Things have been looking a lot better. We may very well get word even as early as next week about moving into red. Schools, however, can't go until another couple of weeks at least after that to make changes. So I know in our school district, and I'm sure a number of others, because our superintendents and the health department get together on a regular basis to discuss these things, we're trying to see what it would look like to bring kids back to school at the same time that there are families that don't want to continue to have remote learning for the foreseeable future for various reasons, whether it's risk factors at home or for some just the fear of gathering in groups still at this point. So I can tell you that all of the school districts within our county in Contra Costa are going through the same process right now of first trying to shore up remote learning the best it can possibly be, and at the same time looking for transitions. One of the things that were offered to us was waivers for kindergarten through 6th grade that can be done during the purple period to bring those kids back to school. But one of the things that we found was when it comes down to distance learning, for the spacing within schools, a cohort being 14 students and 1 or 2 adults would not allow for a single teacher to be responsible for 2 cohorts, which means that even to try to bring all of our K6 students back to school, we would need to double our teacher population in order to be able to cover what would normally be like a 28 kid classroom. It makes it almost impossible to look at waivers right now. But as I say, it looks like we may very well be moving into the red period in the next several weeks here. And that affects K6 kids. Secondary becomes a bigger issue as they're in the middle of a grading period with their teachers, and the possibility of moving to that next transition period where you might not have the same teacher. And so trying to find the best times of making these kind of changes, even as we're able to, becomes a very complex issue. So there's a whole lot of complexity about this whole topic. But as each of the districts are working through it with the support of the county and county health department and the direction we get from the state, we're continuing to work on it. And I'm sure, like I say, it's something that's affecting each of you, either in your positions or in your own home life. So that's kind of where we're at.
Right, Ken, thanks. And I also want to recognize Ken as the chair of East Bay Leadership Council Board, representing AT&T, which we appreciate, Ken. So Lindy, in the last minute or so that we have here, can you not only remind us of the next meeting, but also give us any additional information before we go, including Measure X potentially going forward?
Absolutely. So Mariana put some information in the chat regarding Measure X. It sounds like there's going to be a stakeholder forum, so I'll try to send that out to this group for those that are interested in taking part in learning more about that. I also wanted to mention that there is a chancellor search occurring here at the Contra Costa Community College District. This has actually been going on for some time. It was put on pause because of COVID and has been restarted, and they have identified 2 finalists. I'm going to put all the details about that and the actual meeting that's occurring tomorrow on the 17th regarding that in the chat. So for those of you who are interested, just hold on for a moment after this leaves and feel free to copy and paste that, or just get it from me at a later date if you're interested. But it will be put in the chat right here.
Super.
Thank you, Bob. Oh, I'm sorry. And our next meeting is October 21st. We'll probably have it at the same time, 1 o'clock, but feel free to look out for an invitation about a week ahead about that next meeting for me.
Yeah, contributions to the agenda. I put my email address in the chat also. And with that, we thank everybody for being here today. We had 34 that originally started in today's discussion. And with that, I'm sure we will improve the flow much better in the next couple of meetings. So again, thank you all for being here and have a great rest of the day. Bye, everybody.
Thank you all.
Thanks.
Thank you.